Hemostasis. Textbook. Guyton and Hall. Textbook of Medical Physiology. 11th edition. Pages 457 to 468. Chapter 36. Hemostasis and blood coagulation. Part 4. Conditions that cause excessive bleeding in human beings. Conditions that cause excessive bleeding in human beings. Excessive bleeding can result from deficiency of any one of the many blood clotting factors. 3 particular types of bleeding tendencies that have been studied to the greatest extent are discussed here. Bleeding caused by 1. Vitamin K deficiency, 2. Hemophilia, and 3. Thrombocytopenia, platelet deficiency. Decreased prothrombin, factor 7, factor 9, and factor 10 caused by vitamin K deficiency. With few exceptions, almost all the blood clotting factors are formed by the liver. Therefore, diseases of the liver such as hepatitis, cirrhosis, and acute yellow atrophy can sometimes depress the clotting system so greatly that the patient develops a severe tendency to bleed. Another cause of depressed formation of clotting factors by the liver is vitamin K deficiency. Vitamin K is necessary for liver formation of VE of the important clotting factors, prothrombin, factor 7, factor 9, factor 10, and protein C. In the absence of vitamin K, subsequent insufficiency of these coagulation factors in the blood can lead to serious bleeding tendencies. Decreased prothrombin, factor 7, factor 9, and factor 10 caused by vitamin K deficiency. Vitamin K is continually synthesized in the intestinal tract by bacteria, so that vitamin K deficiency seldom occurs in the normal person as a result of vitamin K absence from the diet, except in neonates before they establish their intestinal bacterial aura. However, in gastrointestinal disease, vitamin K deficiency often occurs as a result of poor absorption of fats from the gastrointestinal tract. The reason is that vitamin K is fat-soluble and ordinarily is absorbed into the blood along with the fats. One of the most prevalent causes of vitamin K deficiency is failure of the liver to secrete bile into the gastrointestinal tract, which occurs either as a result of obstruction of the bile ducts or as a result of liver disease. Lack of bile prevents adequate fat digestion and absorption and, therefore, depresses vitamin K absorption as well. Thus, liver disease often causes decreased production of prothrombin and some other clotting factors both because of poor vitamin K absorption and because of the diseased liver cells. Because of this, vitamin K is injected into all surgical patients with liver disease or with obstructed bile ducts before performing the surgical procedure. Ordinarily, if vitamin K is given to a deficient patient 4 to 8 hours before the operation and the liver parenchymal cells are at least one-half normal in function, sufficient clotting factors will be produced to prevent excessive bleeding during the operation. Hemophilia. Hemophilia. Hemophilia is a bleeding disease that occurs almost exclusively in males. In 85% of cases, it is caused by an abnormality or deficiency of factor VIII. This type of hemophilia is called hemophilia A or classic hemophilia. About 1 of every 10,000 males in the United States has classic hemophilia. In the other 15% of hemophilia patients, the bleeding tendency is caused by deficiency of factor IX. Both of these factors are transmitted genetically by way of the female chromosome. Therefore, almost never will a woman have hemophilia because at least one of her 2 10 chromosomes will have the appropriate genes. If one of her 10 chromosomes is deficient, she will be a hemophilia carrier, transmitting the disease to half of her male offspring and transmitting the carrier state to half of her female offspring. The bleeding trait in hemophilia can have various degrees of severity, depending on the character of the genetic deficiency. Bleeding usually does not occur except after trauma, but in some patients, the degree of trauma required to cause severe and prolonged bleeding may be so mild that it is hardly noticeable. For instance, bleeding can often last for days after extraction of a tooth. Factor VIII has 2 active components, a large component with a molecular weight in the millions and a smaller component with a molecular weight of about 230,000. The smaller component is most important in the intrinsic pathway for clotting, and it is deficiency of this part of factor VIII that causes classic hemophilia. Another bleeding disease with somewhat different characteristics, called von Willebrand's disease, results from loss of the large component. When a person with classic hemophilia experiences severe prolonged bleeding, Almost the only therapy that is truly effective is injection of purid factor VIII. The cost of factor VIII is high, and its availability is limited because it can be gathered only from human blood and only in extremely small quantities. Thrombocytopenia. Thrombocytopenia. Thrombocytopenia means the presence of very low numbers of platelets in the circulating blood. People with thrombocytopenia have a tendency to bleed, as do hemophiliacs, except that the bleeding is usually from many small venules or capillaries, rather than from larger vessels as in hemophilia. As a result, small punctate hemorrhages occur throughout all the body tissues. The skin of such a person displays many small, purplish blotches, giving the disease the name thrombocytopenic purpura. As stated earlier, platelets are especially important for repair of minute breaks in capillaries and other small vessels. Thrombocytopenia. Ordinarily, bleeding will not occur until the number of platelets in the blood falls below 50,000 per milliliter, rather than the normal 150,000 to 300,000. Levels as low as 10,000 per milliliter are frequently lethal. Even without making specific platelet counts in the blood, sometimes one can suspect the existence of thrombocytopenia if the person's blood fails to retract, because, as pointed out earlier, clot retraction is normally dependent on release of multiple coagulation factors from the large numbers of platelets entrapped in the brin mesh of the clot. Thrombocytopenia. Most people with thrombocytopenia have the disease known as idiopathic thrombocytopenia, which means thrombocytopenia of unknown cause. In most of these people, it has been discovered that for unknown reasons, specific antibodies have formed and react against the platelets themselves to destroy them. Relief from bleeding for 1 to 4 days can often be effected in a patient with thrombocytopenia by giving fresh whole blood transfusions that contain large numbers of platelets. Also, splenectomy is often helpful, sometimes effecting almost complete cure because the spleen normally removes large numbers of platelets from the blood. Thromboembolic conditions in the human being. Thrombi and emboli. An abnormal clot that develops in a blood vessel is called a thrombus. Once a clot has developed, continued flow of blood past the clot is likely to break it away from its attachment and cause the clot to owe with the blood. Such freely owing clots are known as emboli. Also, emboli that originate in large arteries or in the left side of the heart can owe peripherally and plug arteries or arterioles in the brain, kidneys, or elsewhere. Emboli that originate in the venous system or in the right side of the heart generally owe into the lungs to cause pulmonary arterial embolism. Cause of thromboembolic conditions. The causes of thromboembolic conditions in the human being are usually twofold. 1. Any roughened endothelial surface of a vessel as may be caused by arteriosclerosis, infection, or trauma is likely to initiate the clotting process. 2. Blood often clots when it ows very slowly through blood vessels, where small quantities of thrombin and other procoagulants are always being formed. Use of TPA in treating intravascular clots. Genetically engineered TPA, tissue plasminogen activator, is available. When delivered directly to a thrombosed area through a catheter, it is effective in activating plasminogen to plasmin, which in turn can dissolve some intravascular clots. For instance, if used within the RST hour or so after thrombotic occlusion of a coronary artery, the heart is often spared serious damage. Femoral venous thrombosis and massive pulmonary embolism. Femoral venous thrombosis and massive pulmonary embolism. Because clotting almost always occurs when blood is blocked for many hours in any vessel of the body, the immobility of patients conned to bed plus the practice of propping the knees with pillows often causes intravascular clotting because of blood stasis in one or more of the leg veins for hours at a time. Then the clot grows, mainly in the direction of the slowly moving venous blood, sometimes growing the entire length of the leg veins and occasionally even up into the common iliac vein and inferior vena cava. Then, about 1 time out of every 10, a large part of the clot disengages from its attachments to the vessel wall and goes freely with the venous blood through the right side of the heart and into the pulmonary arteries to cause massive blockage of the pulmonary arteries, called massive pulmonary embolism. If the clot is large enough to occlude both of the pulmonary arteries at the same time, immediate death ensues. If only one pulmonary artery is blocked, death may not occur, or the embolism may lead to death a few hours to several days later because of further growth of the clot within the pulmonary vessels. But, again, TPA therapy can be a lifesaver. Disseminated intravascular coagulation. Disseminated intravascular coagulation. Occasionally the clotting mechanism becomes activated in widespread areas of the circulation, giving rise to the condition called disseminated intravascular coagulation. This often results from the presence of large amounts of traumatized or dying tissue in the body that releases great quantities of tissue factor into the blood. Frequently, the clots are small but numerous, and they plug a large share of the small peripheral blood vessels. Disseminated intravascular coagulation. This occurs especially in patients with widespread septicemia, in which either circulating bacteria or bacterial toxins, especially endotoxins, activate the clotting mechanisms. Plugging of small peripheral vessels greatly diminishes delivery of oxygen and other nutrients to the tissues, a situation that leads to or exacerbates circulatory shock. It is partly for this reason that septicemic shock is lethal in 85% or more of patients. Disseminated intravascular coagulation. A peculiar effect of disseminated intravascular coagulation is that the patient on occasion begins to bleed. The reason for this is that so many of the clotting factors are removed by the widespread clotting that too few procoagulants remain to allow normal hemostasis of the remaining blood. Do you have any question?